All right, highlighting National Oral Cancer Awareness for the month of April. To be aware of the risks of oral cancer and to get screened regularly, especially if you are at risk, we have Dr. Vincent Smith with Elite Dental here to tell us more about oral cancer. Thank you for joining us.
Thank you for having me.
So first, I'm just going to ask you the most basic question. What is oral cancer?
Oral cancer is lesions that can be found in your mouth, in your head or neck area that do not go away, that are similar to other cancers of the body, but just manifest themselves in the head and neck area, such as your jaw, your maxilla of your face, or whatever like that.
And so what are some of the signs? Like, how do you know you might have this issue?
Well, the first sign is a sore or a lesion in your mouth, like a change in the color that doesn't go away. Usually in your mouth, if something happens, like you bite your cheek or something like that, it will heal right away. When it doesn't happen, then there might be an issue. And that's when you should go get your dentist to check it out.
Okay, and how do you get screened? What is the procedure with that?
Well, basically, routine dental checks. Every time you come to the dentist, the dentist should check your mouth for any type of changes in your mouth. Usually every patient I see, I make sure everything looks the same. And if there's something that doesn't look like it should, then I will ask them to take a closer look at it.
So let me get this right. If there's like a problem in a certain area and you keep feeling that problem in that same area.
Exactly. Like mostly discolorations, maybe a swelling of some area, maybe an area that it just changes and it doesn't go away. Sometimes it's pain, sometimes it can be numbness that's associated with it. It's a lot of different factors that can go into something. You always should just check your mouth every day as you're brushing your teeth. Make sure everything looks the same, feels the same, and is, you feel like it's normal.
Okay, so we have about less than a minute. How do you treat it? So, like, let's say you're diagnosed.
You're diagnosed. First of all, if there's a change, you would get a biopsy. They would check it out to see what type of issue it is, what type of cancer it would be, and then you would treat it like normal with radiation, chemo, and excision and removal of the lesion.
And who's at risk? Is it a certain age group?
Actually, smokers. Smokers are the highest risk. They're 6 times more likely to get an oral cancer than any other people. Older men are at a higher risk. Excessive drinking can cause oral cancer to actually manifest itself. So those are the main factors that you kind of need to look out for. Okay,
2 more really quick questions. So how could we find you if we want to get this oral screening?
We're located in Upper Northwest Tacoma Park, right off of close to Georgia Avenue. So we're there. We have our location in Wheaton. We're always there accepting new patients, and anybody that needs an oral cancer screening, we're there to help.
And what are 2 things to prevent it that we can do at home?
Diet.
Diet.
And I would say making sure you don't smoke, or you just lower the amount of alcohol you consume. That would be pretty much the assumption for that.
Okay, well, thank you so much, Dr. Vincent Smith with Elite Dental. Thank you so much for joining us on DC News Now.
Thank you for having me.
Back to you.